Morning. My name is Doug McCoy, and I'm the CEO for Eastern Plumas Healthcare. And I wanted to provide a follow-up to the video that we did earlier this year on the impacts of the Medicaid cuts through the H.R. 1 legislation, better known as the One Big Beautiful Bill. As we reported earlier, this has substantial impacts to rural hospitals across the country, but certainly also in California. Approximately $128 billion over the next 10 years. So there have been a lot of questions about what does that mean for me as a patient? What does that mean for the long-term viability of my healthcare provider? And so we wanted to be very responsible and transparent to share with all of you the situation for EPHC and our plans going forward. Right now, actually in October of 2025, as a result of the cuts, there has already been one hospital that has closed in October of last year. There are 6 currently right now, about 10% of the rural hospital facilities in California that are at imminent risk of closure, and another 23 that are at high risk. I'm very pleased to continue to report that EPHC is in a very good position. We have spent a lot of time over the last several years making sure that we're able to continue to provide services and grow services as we're going forward. But specifically in the last 90 days, we have taken a look at what the impacts are going to be for EPHC, which are significant over the next 5 to 7 years. And we started with a strategic plan on how we would mitigate those impacts. And so I'm very pleased to report that the impacts which we see starting in fiscal year 27-28, we have actually come up with plans to mitigate actually all of those cut reductions to EPHC so that we can ensure that we don't have any service interruptions or issues going forward. We're very excited, and I appreciate the work done by our board of directors and our leadership team because those mitigation strategies that we have put together first allow us to continue to grow. We're excited about that. We added on the Senior Life Solutions program to EPHC in October. We are expanding our rehab program to a new location. We're expanding our CalAIM services. We actually added 7 new providers in 2025. So as part of our mitigation strategy, we're actually not reducing services, we're growing services. And our mitigation strategy to offset those cuts actually also don't come with the loss of any personnel or any impacts to any of the services we're currently providing. So we're very excited about that. So one question would be, well, how did we do that? And we've done that through a series of specific initiatives. Some of those have been reestablishing different contracts to get better pricing. We have leveraged technology in several areas, including for our providers through the use of AI to allow them to be able to be more efficient and spend more time with the patient. We have expanded, as I said, services. We've reinstituted our MRI services here, and those will continue to grow. We've added services, as I mentioned, with Senior Life Solutions and others. We've renegotiated some of our contracted rates with our payers. So all in all of those strategies and initiatives put together have actually, we have forecasted that the significant cuts that we'll see in 27-28 will actually not impact our ability to continue to provide services going forward. So we're very excited about that. We want to make sure that as you as a community member hear information about what is happening in California hospitals, that you're well aware and updated that EPHC continues to be in a strong position, that we have actually, as I've said, eliminated the risk for cut reductions, and that we will be stronger than ever to be able to continue to service you and provide even more services as we're going forward into the future. So we will provide more updates as we go. Our goal is to be completely transparent, but also to eliminate any fears or concerns about the security of your healthcare delivery going forward for you and your family. As always, we are very proud to be able to serve all the members of our community, and we are looking forward to a wonderful 2026 and beyond, and appreciate your support. Thank you.